Hi, I'm Dr. Kane. How may I help you?
I had a previous breast augmentation and I'm very unhappy with the result. The breasts don't feel the same. You think you can fix them?
Sure. Here's a gown. The changing room is right through there.
Before I do you mind if I ask you a question?
Not at all.
Are you board certified?
Of course. My diploma's right over there.
Oh, I see, yes. Well, but why don't you put it over there behind you? That way I wouldn't have to turn my head around. It's very awkward.
Oh, I'm sorry. It's a good suggestion. I'll remember it for the next patient. Okay, so tell me from the beginning, what exactly is the problem?
My breasts don't feel normal. The right one is up, and the left one is down. I'm afraid to look at them.
Well, when was your surgery?
About 3 months ago.
And you haven't looked at your breast in 3 months?
Yes! I mean, are you the only doctor here?
Yes, why do you ask?
Well, shouldn't you have another doctor here to consult with in case you don't know what to do?
My dear, I've been in practice for over 50 years. I'm an expert on post-augmentation breast problems. I'll know what to do. But first, I have to examine you.
I just want to make sure
Of what?
that you're the right plastic surgeon for me.
But how can you know that without me examining you?
Hold out your hand.
What for?
I want to see if they shake.
No one ever asked me that before.
It's in a manual called How to Choose a Plastic Surgeon. I'm supposed to be asking these questions. Which hand do you use to operate with?
I operate with my right hand.
They say that your doctor should be ambidextrous in case one hand cramps up.
Huh.
Come on, doctor, don't be evasive. Both hands, please.
All right, here, see? Steady as a rock.
Oh, not bad for your age. Your hands are soft and fleshy. Let me look at your palm line.
This is supposed to be your consultation, not mine.
Oh, that's rare. You have a simian line. It means you're either an idiot or a genius. Which is it? Well, I guess you aren't an idiot. You couldn't have gone to medical school if you were. You have more lines than I do. But then you are older than I am. Well, I see your head and your heart line converge and join up. It means marriage is in your future.
It seems I'm running out of the future.
See, mine are separated, which means I'll never get married.
How surprising.
Do you think you could do an operation that joins them together so I could get married?
Sure. But can we get back to your breasts?
I don't want them made bigger. I just want them to be equal.
Okay, but I think we have to start with my seeing them.
Have you ever seen this problem before?
Sure, but on you I've only heard about it. Look, here's the gown. Please put it on, and I can examine you and bring you up to date, and then we can talk about an appropriate surgical procedure.
Why don't you call my original plastic surgeon? She knows my breasts. Why don't you talk to her?
All right, here's a cell phone. Call your other doctor.
I've been
and I'll
trying
speak
to
her.
reach her, and she doesn't pick up the phone.
Really? What's her name?
Dr. Virginia Feinberg.
From Plainfield?
Yes.
Oh, I know. She's a dear colleague of mine. She died.
Dead or not, I'm certain she put the implants in the wrong position. When I felt my breasts, I freaked out. I called her, and I told her if she couldn't fix them, I wanted my money back. Otherwise, I was going to a lawyer. Then she went silent on me. I called back many times, but the line was always busy. How'd she die?
She had a heart attack in her office. They found her collapsed with a cell phone clutched in her hand. God knows who she was talking to.
Are you implying that my call to her had something to do with her death? She was a heavy smoker. Did you know that?
I'm not implying anything. Lots of doctors die with cell phones clutched in their hands.
Oh, she smoked like a fiend. I had nicotine stains on my breasts. Well, since you can't talk to her, will you be able to tell from my examination just what surgery to perform?
Of course.
And doctor, when was the last time you did a breast examination?
I beg your pardon.
When was your most recent breast examination?
Why should that concern you?
And why not?
It's a totally inappropriate question.
Look, according to the manual, these are the most important questions I should be asking my plastic surgeon.
Well, first of all, I'm not your plastic surgeon. I haven't even examined your breasts. And now I've decided I don't want to be your plastic surgeon.
Why not?
Because my doctor manual tells me to avoid patients like you.
Why?
Because you fall into the category of the killer patient. You won't be happy no matter how successful the surgery is, and you will without a doubt sue me.
You're just being overly sensitive, Doctor. Speaking of which, have you ever been sued?
Again with the killer questions. No, I have never been sued.
Never. They say if you've never been sued, you haven't done many operations.
So I'm damned if I have, and I'm damned if I haven't.
Weren't you mentioned in the silicone implant class action suit? Most plastic surgeons were.
No, I was not. Listen, I'm an artist. My patients love my breast augmentations. It's the best operation that I do. They feel good about themselves. My surgical scrub nurse, Sergeant Denanda, loves this operation above all the others that I do. She's 75 years old and she's been around. She knows who's good and who isn't. All my breast augmentations look beautiful.
75? Isn't she a little old to be assisting you?
I'm going to have to politely ask you to leave my office now.
On what grounds, Doctor? I could report you to the Office of Professional Medical Conduct. You could lose your license. Doctor? Doctor? Nurse? I believe the doctor is dead. I wonder, is there another plastic surgeon I can consult with?
Okay, bring in the next patient.